couple other things that we have out on the table in the information group as far as, and we're passing that around now. There's a handout called Saints with Patience. And you may be interested in helping out as a volunteer. And this is going to be a network that we're going to organize. And really, it could be people that were drivers. It could be people that are going to help move furniture. There's other organizations that are doing this in the Twin Cities, and there's a lot of good things already happening, but we know there's gaps. We know there's things that also people want to do in different community settings, whether it be a church or a group or a community group that meets occasionally, or they'd want to take on a project. So we'd like you to fill out the Saints with Patience and also the evaluation so we have an idea. If you have anything bad to say about Jake Chaya, he's sitting right over here. Just as a reminder, we have Michele O'Brien, we have Jim Lund, and Jeane-Marie Bakken, and I'm Jake. So as you go through it, Pastor Roger won't be here this time. He's just starting on his sermon for tomorrow. No, that's a bad joke. We'll have to edit that. But what we want to do is talk about things that you want to talk about for the last half hour and then talk about some next steps. So your question. Now just one at a time. We'll get to each one of you.
Can I just ask a question before you guys ask a question?
Microphone.
I just kind of want to know who is still here in terms of cancer survivors. Oh, you mean like really use it? Okay. So how many that are here are cancer survivors? Okay, and then caregivers? And what are the rest of you? Just say, go ahead. Huh? Okay. Okay. It just helps us, I think, in our response to kind of know.
Yeah.
So, thank you.
Okay. You got to take it away from her. She's got the microphone.
Is this working? Okay.
Yep.
I guess this might be for, I don't know, well, you two there, but have you ever heard the green bananas thing, saying about, sometimes old people will say, well, I don't buy green bananas anymore because, you don't know if I'm going to be around in 2 days to eat them, so I buy ripe bananas. That's kind of the thing.
Right.
Well, there's also the green bananas thing in, when you get diagnosed, and I was diagnosed back almost 2 years ago, but in August it was said I was palliative, which means it's adios amigos. So it's like now I can't feel like I can make plans for anything. Right now, something else happened, and right now it looks okay, but who knows, So
Right.
every time I go back to see a blood sample or a CT scan or something, then you live between those, it seems like, and I feel like you can't make plans. Like if I would think about making plans to do a cruise to Alaska in July,
Mm-hmm.
I just kind of like, why do I want to make plans? So how do you, I don't know how to get around that. I know I should just mental attitude, but what do you think about that?
You want first or you want me?
Well, I think we can all speak to it from all
Yeah.
of our different perspectives.
Good.
One of the things I was kind of taking notes over there a little earlier.
Yes, she's getting in trouble.
It's going to be my new. One of the things that I was making notes about earlier is that we really haven't totally touched on is about making meaning out of this whole experience. And I'm kind of going sideways a little bit on your question, but these are the types of things that arise, and that sometimes things are said to cancer survivors about, looking at the meaning of it in your life and the lessons that you learn and the opportunities you find, and that's all fine and well, but sometimes that just doesn't work. You know, it just feels like it sometimes makes survivors angry. Like, it's enough that I've got cancer to deal with, thank you very much. Don't start making me appreciate it and all of that. It's sometimes further down the line that starts to kind of happen, and you do start redefining and making meaning of the experience, and how has this impacted my life and the people around me, and so on and so on. You bring up something that's really, really, really interesting, which is none of us, well, I shouldn't say none of us, but most of us are not very good about living in the moment. And we all anticipate the future. And there's a fellow in town that has written the most beautiful little booklet, and it's called Loss of Dreams. His name is Ted Bowman, and he's a professor at the University of Minnesota. And he addresses this very thing about how we go on in life just assuming and anticipating, making our plans, and kind of just walking the general line that we're all kind of raised believing is out there for us and is just going to happen. And what you're talking about is that very experience of, we're always kind of thinking about a vacation or a travel or our kids in college or getting a grandchild or, you know, whatever it might be that we're anticipating the future. That just feels like now I'm dating myself again, like the needle across the record. You know, just, it's all scratched. And how do I go forward now? You know, how do I even anticipate any joy in the future or have any kind of meaning when I feel like all I can do is plan maybe this week at level best? And so I don't know that I have the answer for you, because the reality is, to plan a cruise, you do need to do it months in advance. So, you know, maybe you need to, now you could probably speak to this, get insurance on the cruise or something like that. So hope for the best, prepare for the worst is often what I hear a lot of people talking to me about is, I'm going to keep planning for my miracle, I'm going to plan for the best, I'm going to plan for a very positive outcome. But I also know life is life, and in this journey there are right turns and left turns and interruptions. And so, you know, you just kind of have to look at everything just a little bit differently. And then look at what is giving your life meaning and purpose on a day-to-day basis, and starting to look at those blessings and those joys. And I think I can speak to, I just get in the habit of just assuming things are going to be there for me. And, you know, you get a wake-up call, don't assume.
And I want to pick this apart a little bit. I want to take it a little step further. Part of what I hear, and you can correct me if I'm wrong, is I'm afraid to plan ahead. I'm afraid of the unknown, that the rug might get pulled out from underneath me again. And because I'm afraid that the rug might get pulled out from underneath me, I'm fearful, so I don't want to plan here on something that I'd like to plan for, because part of it is the disappointment if I can't accomplish it. And yeah, and I think it's a combination of those kind of things. And usually when I'm working with patients and families, I say, okay, we have to shorten our intervals sometimes, you know, to say, I had a patient that had advanced cancer that he was feeling that loss of not being able to plan. So what him and his partner started doing is planning small events monthly, and saying, okay, we're going to go to Door County this month, or we're going to go to Duluth this time, or we're going to go here, whatever, just short ones. But then at a 6-month interval, they planned a bigger one with insurance, saying that we're shortening our event intervals, saying that I'm going to reasonably for myself plan a month at a time, because I don't want that sense of rejection if we can't do it, or if something changes. Because it's that psychology behind it of that loss. You know, I don't want to experience another loss if something kind of gets shook a little bit. So, you know, I'm not really answering your question either, but I'm saying, okay, let's get back to what's getting you. Is it the not being able to take the trip, or is it the fear of not being able to take the trip, or that something happens? You see where I'm going kind of with that? Yeah. Because I think if you can put that egg in your Teflon pan and cook it a little bit, you can figure out, well, what is getting me here? You know, what's getting me, and how do I move past that small window of expectation?
My add-on would be going back to your bouncing ball.
Yeah.
You know, being able to balance, and your suggestion of shortening the time interval is what I mentioned when I was talking earlier about some clients that have been able to keep themselves in the center by continuing to plan for their future. It's important to them and to their family to continue to plan as if they're going to continue for a long, healthy life. And I see the joy in their ability to participate in these family activities. They've sped up their travel expenditures and so on. They just got back from Hawaii. Somebody else said you were in Hawaii.
Yep.
There you go. So in any case, I think that helps you balance your center, keeps you centered.
But you know, and allowing the fact that things might shift, you know, things might change, things might, you know, that that's how us as Americans live with. Okay, in a month from now, I'm going to do this. In 2 months, I'm going to do this. And in 10 years, I'm going to be here. And it's hard because that's our world. And how do we shift that so that we don't feel like, I always say to patients, you can control cancer or cancer can control you. It's easy to say, you know, I'm like a Jeane-Marie, I'll stand here and preach all day, you know. I mean, I'm going to be a blubbering mess if and when it ever happens to me in my life, you know. So I think you try to look at, okay, what's getting you? You know, it's like that sense of unknown is hard. And people will say, you know, Michele, when I get a headache, I don't just get a headache like you do. I go, I get it. I know. You know, you start worrying right away. What is it? Is it something new? Is it back? You know, that kind of stuff. And how do we center it back in to that core again? I guess that's like my best balance of explaining to people.
I have a book recommendation.
I'm going to give her
everybody in my life, I need a keeper, and I'm proving it. Have any of you in here read Man's Search for Meaning? Good. Man's Search for Meaning, and it's by a fellow named Viktor Frankl, Frankl. I tell my Renewing Life people that it's mandatory before you die. It is the most remarkable amount of survivorship I've ever read, and it's a fellow that was in a concentration camp during the World War. And it's his story of survival. And he can do it better than anybody in terms of talking about survivorship on an hour-to-hour basis, and at the same time talking about the meaning that he found in that experience, during the experience and when he came out of the experience. And anything that I can, now see, I'm a reader, so that's, not everybody is, but for me, that book puts so much into perspective in terms of what's really important, once again, you know. And I'm just throwing it out there because I just think it's such a remarkable work of survivorship.
I got another question maybe for Michele. I don't want to dominate it. Please come up. Now, I know most medical professionals, you know, are caring and they're really trying to help and they're working with the tools they have and everything, but I've met other people who express this frustration who've dealt with it for a while. After a while, you start feeling like you're a cog in this big medical machine. You're this doctor to that doctor, this process, this procedure, this blood test, that blood test, plus, you know, endless things like that. And I found myself getting really alienated from it or feeling frustrated and like, you know, I've had enough. Just leave me the hell alone for a while. And, yeah, but I know, like I said, I know they got good intention and they love it to help people and everything, but I don't really, it just kind of went away after a while because I got over it, but I mean.
Right. No, completely real, okay, number one. And I can say that, you know, and this is our disciplines, you know, our disciplines as far as health professionals. Jeane-Marie and I, you know, are like out of the same pea pod, so, you know, we understand each other. I had a conversation with a physician at one time about why can't we do blah, 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 blah. And it was the best eye-opening thing for me, because he said, I have to make decisions not based on emotion. I have to make decisions that are clinically sound, that have evidence behind them, and that aren't always popular. Now, and then he turned to me and said, that's why I have you. You know? And I think, honestly, we all get caught up in it. You know, people say nursing. And people might watch this video and want to come find me. Nursing in itself, there's nurses that are phenomenal and nurturers, and they're going to fill you up, and they're going to sit with you in silence and don't have to say a word, and you're going to feel complete. You're going to feel like they've got you, okay? And then you're going to have other nurses that are doing their job, okay? So I think, again, it talks to expectations. Knowing what the roles are, and knowing that I sometimes will get frustrated with physician colleagues at times because they're very paternalistic, and that is the medicine. I mean, that's medicine. It's very gray. It's not black or white, and people want black or white, okay? The things that I think patients need is sometimes the simple things, like explain to me why I'm coming back again for this blood test. The rationale just behind that, like what's the value of this? And sometimes just a simple question about, explain to me why I need to come back for this piece. And I've said to patients sometimes, you know what, I messed up. I forgot to order it last time, and I'm sorry, and I'm having to come back because I messed up. Well, that's unique. You know, I don't think healthcare a lot of times will do that thing. But I have had patients that have said, I'm tired of the system. It doesn't run smoothly. I feel like a ping pong ball on this thing, and I don't know who's my quarterback, and I'm tired. And that's when you got to find, like, who is your, like Jeane-Marie was saying, who is your filler-upper again? Who's your nurturer? Who's the one that's going to understand that? And I tell patients, I don't want to fit cancer into life. I want your life to fit into cancer. So I give people the ability to say, can't make it today. Tomorrow's probably better. See what I mean? It's like advocacy. Yeah, because you do. You feel like that. I mean, you walk into our clinic, and your life that you knew it is controlled by us. Oh yeah, you're going to be here at this time, here at this time, here at this time, here at this time. We're going to give you this awful prep, and go lightly. Whoever invented that, it should be shot.
Misnomer ever.
Horrible. And then you're going to come back tomorrow and have this, 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 and this. Okay? It's that loss of being a person and having that power. So I think recognizing it, verbalizing it like you just did, is a huge thing. And just knowing that I don't always want to come back here. I don't always want to do these things. But the power that you have, the follow-up that you do, staying on a regimen of follow-up is your power to, if the cancer is going to come back, if you have side effects that need to be managed, the more proactive you are in that scenario, the sooner we're going to be able to help. So that's what I had a guy that was scared to death to come back because he was afraid it was cancer's, as soon as he sees me, cancer's going to be back. And I said, I can't help you if I don't see you for a year, because 3 months ago I could have maybe done something. And now it's to a point where I can't help you. You know what I mean? Do you see what I'm saying? Kind of that scenario. I don't know if I helped, but.
Sorry. The other thing I would add is that I think it helps just to normalize the experience, to realize that you're not alone, that you're not the only patient that's saying, every patient says it, every single one, that they feel like they just live on the road, they're constantly going to appointments, they don't have their own life, just drives you wacky. I mean, it's a very common experience. It's not a solution, it's not an answer, but I think there's sort of comfort in knowing that you're normal for feeling a certain way. And the more you come to people like us and just talk about it and say, oh, then maybe we can help you think of solutions to slow down the train a little bit or redirect the train, throw it on a different track, do it a different way. But if we don't know how it's affecting someone, there really is nothing to be done. And, you know, in Minnesota, it's kind of amusing. We don't like groups, you know, in this state. We don't, oh, no. We don't like to go to a group. But the cool thing about a group and being with other survivors or caregivers with other caregivers is that normalizing thing where it's like, oh, you too, really? And there's great comfort in that.
Well, and using Jeane-Marie and I, because we can be that advocate with the physician colleagues that sometimes, you know, sometimes they're brilliant and they're phenomenal and they explain things phenomenally, but it's in Japanese, okay? You know, it's up here, and so I come in and go, I'm your interpreter, okay? So I'm going to interpret for you. You know, finding who your interpreters are, because I think that's what's daunting is they're phenomenal in there, and we couldn't live our lives without people in our lives. So people that have the expertise, that have the education, that have the background. But where are all the pieces, kind of the puzzle pieces? You know, you got to find your interpreter. You got to find your crack filler. I mean, it said I'm the crack filler, that, you know, those kind of things, because it helps to feel not so daunting. Does that make sense?
Crack filler, scarecrow.
Yeah, aren't we great?
Which brings up a couple people have come up and said, well, now what? Now we leave the conference today, and what if we really do run into something? Always call me. I don't care where you're from, who your doctor is. I don't care. I don't care. I mean, that's my role. That's what I do. I want to help. And so if you want to call me ever in the future, please feel welcome. And here's my number, 612. Not that any of you are ever going to have a problem.
I call her all the time.
219. Oh, I'm sorry.
Oh, we got to find a pen.
Okay, 612-219-0707. And I welcome calls from anybody in the community, because there really is no advice on a jumping off point where to start. It's Jeane Bakken, B-A-K-K-E-N.
And then for you know, people were asking me, I think for the survivorship clinic, the hard part is you have to be a patient of Minnesota Oncology. So that's the bummer, you know. It's not like a high-risk genetics piece. You know, we have a high-risk genetic piece that they'll see people that are not our patients that come in order to be able to, you know, bill for services and that kind of stuff. You gotta be a patient of Minnesota Oncology. It's a bummer. But the positive thing is eventually this program is going to be offered in all our clinics. The goal is, my challenge is they want me to have it by 2013, you know, another 7 clinics. Oh, no big deal, right? So, yeah, and you know, definitely if you are a Minnesota Oncology patient, but you're being treated in Burnsville, in Maplewood, in St. Paul, you can come to see me in Edina. We have nurses in Minneapolis clinic that are doing it, and we have a nurse in Coon Rapids clinic that are doing it. So we have 3 clinics that they are doing these one-on-ones, sitting with you. So. Any more? Okay, fire away.
Gary's got a question.
More for Jim maybe, but I really liked your session, because one of the things I'm concerned about, of course, is if I do die from this, then I don't want to leave my family without assets, you know, that I planned for most of my life. And then one of the fears that, you know, a lot of people I know of have talked about is, you know, yeah, you survived cancer, but now you're broke, you know, you took all your money, or your insurance plan didn't cover this, or blah, 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 and whatever thing.
I've never seen anybody die dead even. So you're either in debt or you have assets. One of the two.
Just to be clear.
Yeah, just to straighten it out.
I guess
I threw you off.
Forgot my question.
That's what
I can
they
blame it
do.
on
So much for trying to, you know. Oh, come on now.
I'm just
Ouch.
kidding.
That's funny.
Maybe like John, blame it
So
on
much for trying to cut a
brain.
joke.
I'd be like John and blame it on chemo fog. But,
Yeah, it's okay.
well, yeah, I guess I just want to say thanks for that, because I like you'd avoid unnecessarily paying out money for things that you maybe could have had covered some other way, number one. Or number two, make sure that the assets that you do have don't get given to the government like you talked about, or somehow get, you know, what are your options? I mean, I'd like to see you clarify a few things like that maybe next time if you had another session. So thank you for that. And I guess the thing I wanted to ask you a little more about is the estate tax. Like if I die and my wife's still around and my assets, I thought in Minnesota, most states go directly to the surviving spouse. Is there anything I should consider putting in an official will to make sure that that happens?
Short answer is yes, and the longer answer is, you know, again, in the state of Minnesota, we can pass on, well, let's back up. If you're married, you can pass on all of your assets, whatever you have, to your spouse. Actually, the law says your designated spouse. I'm not quite sure what designated really indicates. But in any case, you can pass on as much as you own to each other without any estate tax being levied. The tax is levied at the second death, but something has to occur prior to at the first death in order to really take advantage of the code or of the law. And what I mean by that is when I said that there's this unified credit, or maybe I didn't say it was unified, but that's what the government calls it. It's a credit of $1 million at the state of Minnesota level, and currently it's a a little over $5 million credit at the federal level. So let's talk about the state level, because most people don't realize it, they don't think about it. And I'm going to use an example of like $1.5 million a state. You know, I would suggest that most people don't do a whole lot of estate planning. And most people, if they're married, they're going to put all of their assets into joint tenancy. And that's great for avoiding probate and being able to transfer that asset to the survivor. The problem with joint tenancy is that, in my example, if you have $1.5 million, and I use the examples of what's included in your estate, what creates this level of estate, and it's, you know, all of your assets, your financial assets, and your house, and your cars, and your personal belongings, and your insurance proceeds, your life insurance proceeds. And for a lot of folks, you can get above that $1 million level. So again, in my example, I'm going to use 1.5 million. If you, upon the first death, all of those assets transfer into the surviving spouse's estate, and then some days down the road, whenever that person dies, that person now has over $1 million in their taxable estate. So that $500,000 over the million is going to be taxed, and I'm going to suggest it's probably about a $50,000 to $70,000 tax at the state of Minnesota level. That's pretty typical. That's the default. Well, I should say it this way. Fortunately, if you do something now by putting some language in your will, assuming you have a will. If you don't have a will, I suggest everybody get one. The language that needs to be put into the will is pretty straightforward. It either sets up automatically or allows the surviving spouse to choose to implement what we call a credit shelter trust. That trust is set up for the benefit of the surviving spouse. So it's not that you're giving up any beneficial use of an asset or of these assets. That surviving spouse is still going to be able to use those assets how they intended. They can spend that trust down to zero. But what it does is it allows at the first death for that person to use their unified credit of $1 million against it. So in my example, $1.5 million estate, let's say $750,000 of it's in the male spouse's name and $750,000 of it's in the female spouse's name. Use up to that $1 million credit on the first person to die, so $750,000 goes into the separate trust. Let's assume that the next person dies shortly thereafter. Or maybe they died in a common accident, or maybe they lived for 20, 30 years beyond the first death. Regardless, assuming they still have $750,000 in their estate or some other dollar amount that's under $1 million, they use their unified credit of $1 million at that death. So in essence, there's a way to pass on a full $2 million without any estate tax levied whatsoever. But again, like I say, something has to take place at the first death to be able to preserve that person's credit. Does that make sense? Okay.
Well, and I think and I wasn't here, so I apologize, but I think the other challenge that our patients have is they say, well, I don't have anything, Michele. Like, why should I see a financial planner? I don't have anything. And I think what we see over and over that people use credit cards to make their co-payments. They are behind in their mortgage and they don't, banks, they're having trouble communicating with the bank. The bank's saying, no, you're going to go into default. That's what their roles can be, is to help with how are you currently going through your treatment, how are you going to manage the stuff that's coming in, and how do you communicate with your creditors, your mortgage companies, those kind of things to help manage those pieces. Is that fair? That's something you guys can help with? Because that's the in-the-face kind of thing where I think Jake's idea with this and helping patients is helping with that piece. That's the day-to-day, rubber hits the road. I met with a lady and she goes, I have $60,000 worth of bills sitting on my counter and I don't even know where to begin. Okay, so I think there's the estate planning piece, which is phenomenal because I don't think any of us do enough of that. But then there's also this clearing the rubble, is what Jake will say, is how do I help people see the forest through the trees kind of thing, and what things do you need to manage right now as you're kind of moving into this journey. Our drugs are expensive. Some of our drugs there's a new colon cancer drug that's for refractory, all the other chemos don't work. It's $10,000 a month.
Wow.
Okay? So, and it's got good outcomes, but when you're talking about a 20% copay on $10,000, that's not small change, so people make decisions based on, they just see it and say, I can't do it, rather than having somebody help them with that.
Other questions?
I have 4 of them.
Ooh, good. Take the mic.
I want to honor your time too, so I'll just go quickly through them. I would like Michele to talk more about how to communicate with a cancer survivor when the survivor isn't making progress. And how can the focus and topic of discussion move away from eating, not eating, losing weight, and so on? What can the survivor say when asked? That just seems to be such a focus always, and I don't, And then, how can I help someone who is believing God will heal her without chemo or radiation, wants to go the natural way? Not dying, but the natural way. You understand?
Oh, yeah.
Okay, and then, I'm a faith community nurse and need guidelines about how to be involved, but how to discern when cancer patients and family want to be left alone.
Oh, yeah. Boy, those are loaded. That's awesome. Thank you. We can divide them up. Which one do you want?
Pick one. They were actually all addressed to you.
No. Yeah, I can't take them. You want me to take them all?